So I practice in the Integrative Orthodontic Center, which is part of the TMJ and Sleep Therapy Center of Chicago. So this is a practice that very different than most orthodontic practices. We focus on airways especially. We treat a lot of children, especially with sleep apnea, but even adults. Adults are more difficult to treat, but it's kind of a mixed thing. My wife is also a dentist practicing in the basically TMJ and sleep therapy aspect of the practice. So we use the MLS laser on actually every single patient that comes in. That laser is amazing. The way that we practice, we're trying to make skeletal changes. So normal orthodontics actually counts on inflammation to create a situation in which teeth can move into a space where voids are created. With that mechanism, there's no way to take and grow new bone. You're limited to moving teeth within the existing bone. So with the MLS laser, it's amazing the inflammation reduction that we get, plus the pain for patients, plus the accelerated tooth movement that we get. It makes cases go way better. I'm trying to take and move teeth with super, super light forces. When you do that, it's a completely different mechanism than the way teeth are normally moved, and it allows osteoblastic activity at the bone surface, which then, whichever direction you're moving the teeth, you can grow new bone that way. The MLS laser makes that happen better than if we're doing without. In a nutshell, what happens is inflammation is my enemy for this, because in an inflammatory response, you actually counteract the things that would stimulate the osteoblastic activity. So when you have lighter forces, you're actually moving the teeth, nudging them in the direction you want to go. And there's 4 different mechanisms that we really understand. And the mitochondrial activity, the more efficiency in movement that the MLS laser engendered to make that happen so much better. There's actually studies looking at not just at the MLS laser, but other lasers that are at similar frequencies, showing that tooth movement, even when there's some inflammation, ends up happening faster. Unfortunately, most of those studies are on extraction cases and just looking at dragging teeth across the extraction sites. But for me, it makes a difference. I would say on average, using that MLS laser cuts about 1/3 of my treatment time, and that's huge from a patient satisfaction standpoint, from our actually being efficient and getting patients out faster. The treatments that we do are very complicated. Whenever you're trying to make skeletal changes, especially on adults, it can take a long time. So cases that I normally treat out now in 2 years without the laser would really take about 3 years. In our practice, we have 5 MLS lasers. Wow. And we have 5 because every single patient gets laser. We have anywhere 70 to 90 patients every single day. And
they're all getting lasered.
They're all getting lasered. We have a treatment bay and some private rooms. So in the private rooms, because of the legal things with wearing the glasses and everything like that, we can laser there. But everyone who gets treated in the bay, we have a special dedicated lasering room.
Wow.
That is just everybody filters through there. We have every staff member is trained to laser, so that on busy days it doesn't matter. It can be someone from the front desk, whoever, but every single patient gets lasered. We've had patients that have come in, these are usually adults, that are like, oh, I've got a meeting, I've got to go, and then like 2 hours later they'll call back and they go, can I come back and get lasered? It doesn't feel as good as it normally feels. So I mean, even perceptually for the patients it makes a difference. But there are cases where I've had people come in for extra lasering. If we're trying to grow the maxilla forward,
right.
That seems to be the thing that is the most sensitive to, different forces, inflammation creeping up and stuff like that. And when I have patients come in for extra lasering in between, I don't even see them. They come in and we sign, we've got a protocol written down for what these patients need. And with that, the differences are more extreme. When we don't do that, we still get advancement, but it's a little bit less. There are, fortunately for us, you can pre-program these things in.
Right.
So working with, especially Nate Cry from BioResearch in the U.S., he and I sat down and basically figured out, along with Luciano from Italy, what the most effective wavelengths would be, time frames for that. We treat a lot of TMJ patients too, so the TMJ protocols are all well known. So we basically, I write a prescription in effect for every single patient. It's just in our notes, and then there's a computer in there. The staff just looks up and sees what I've assigned to be lasered that day. It could be just one thing, or on some of these patients that are complex. In the U.S. we fortunately have the right to laser all the way basically to your collarbone, so we can do necks, we can do anything up here. So there's I would say typically patients are getting maybe 3 or 4 places lasered.
Okay.
But sometimes it can even be more than that.
Okay.
If we're advancing an entire maxilla non-surgically, then we're doing zygomatic arches, we're doing cruciate suture. Your maxilla is connected to 8 other bones, and so where the stimulation happens is at all the sutures, all the seams between those bones. So as many of those bones, seams that we have access to, that's what we try to laser. So a lot of people don't believe that you can get lateral development on a lower arch. Okay, and the true test of that is, are you, one, uprighting the lower teeth? So instead of just having the teeth move laterally like this and grow new bone there, are you just rocking the teeth out? So that's what most people think happens. So we're very careful to control that, and we take CBCTs on every patient. We take progress ones. You can do this at 11 microsievert exposure, super low radiation, and just monitoring whether there's bone continuing to be formed. And what we're finding, which is what studies from Dwight Damon and other people have found, is that you can laterally expand, certainly on the lower arch, and not only have continuous bone being deposited, the bone dimension when we're done with treatment generally tends to be a little bit thicker than when we started.
Wow.
So the bone's better. I have periodontists that send me cases where they have people who have very thin bone, and they have some vertical bone loss. So we really can't engender vertical changes in bone, but dimensionally around the teeth. So this one guy just sends me a little note. He goes, just move this patient's teeth around, grow me some new bones so that they become more stable. And so we do
grow me some new bones. And the laser does that.
And the laser, along with these light forces together, those things make that happen.
That is amazing.
That's very cool. Yeah. Sometimes for implants, so if we've got patients who have a missing tooth and it's been missing for a long time, so there's collapse of the bone there, we can take and using the laser, because typically if you try to use normal orthodontic forces and move teeth into a position where the bone is collapsed, you don't get anything positive. In fact, you tend to break the roots out of the cortical plate, and you're basically doing a slow extraction on these teeth. With the laser and these light forces, you actually stimulate the bone to grow, and this area where the bone is thinned, you move one tooth partway into that space, and then you move it back, and then you move the tooth behind the space back into it, and when you're done, you've got a full dimension of bone that is ready for implants, and that can be done just during the time of treatment. It's not that big a deal for me to do that while I'm doing other things.
Right.
So that's a great application for the MLS laser. If I try to do that without the laser, it doesn't work as well.
Right.
I certainly want to be as effective as I can with my patients. The lasers they're not outrageously expensive, but they're not cheap. I'm not going to go get them without having some demonstration of effect. When we started using these lasers, we actually started with a different laser that was, it's a different company, not as effective, but still effective. Yeah. And what we found was that we were still getting these bony changes. But for example, if I'm trying to grow new bone forward on the front, I'm lasering with this other laser. I had to laser 1 minute over every single tooth individually. So I get the same effect or better with the MLS laser just with 30 seconds of going back. And we've got 2 different kinds. We've got the one with, we call it the Charlie head. Right. So you can have a fixed point. Say somebody's got some neck issues, cervical spine issues. So cervical spine positions, rotations, things are very related to mandibular position. So we need those things changing at the same time that we're changing things skeletally in your face in order to engender stability. So that we can be lasering here at the same time we're lasering other things with that, and the time savings is amazing. I mean, in any kind of medical dental practice, the most expensive thing you have is your time. Right. So the MLS laser is so much more effective. the dual wavelength thing just seems to really make the biggest difference in time savings and comfort for the patient.
Right.
That's the other thing. You know, patients, like I told you that one sample where the guy called back saying, "Can I get back in and get lasered?" We try everything we can to, in our practice, reduce the inflammatory response from what we do. Orthodontics inherently can be inflammatory, so this makes a huge difference for us. I would say anybody who's not tried one, you know, it's well worth having it. Like I said, you know, we wouldn't have 5 if we didn't find them working. And again, the changes that we make would happen, but not to the same degree and not as quickly without the laser.